Okay, so the next topic is chickenpox. We have started the infectious diseases. The two topics that are remaining are chickenpox and mumps. So, starting from the chickenpox, we are having a scenario that there is a 6 years old patient having low grade fever and malaise for few days, and then he developed few red spots over her neck and chest, which changed to blisters in 2 to 3 days. Now she has macular, papular vesicles, and pustules on her body. So, what is the diagnosis? The causes and okay, another scenario is that there is a 2 years old girl brought to OPD with complaints of fever and vesicular lesions over her chest and abdomen with crusting of some lesions for last 5 days. She also complains of itching as well. She is unvaccinated and elder brother has nephrotic syndrome and taking steroids. The another scenario is that there is 5 years old girl presented with fever and vesicular rash and all over the body. She is unvaccinated. Some lesions are umbilicated and crusted. Okay, so here we are having some diagnostic points that fever is present, malaise is present, red spots are present, and then on the neck and the chest, and macules, papules, vesicles, and pustules are present on her body. Same is here. History of fever, crusting, and not vaccinated, itching, and also having a history of the brother who has nephrotic syndrome. So for the chickenpox we are having the following diagnostic points, that there will be macules, papules, vesicles, and all will be of at different stages. Some will be crusting, some will be vesicles, some will be macules, some will be papules. There will be history of the fever and malaise, and also itchiness may be present. So this is chickenpox. Now we are having a definition that the chickenpox is caused by DNA virus and it is a contagious disease which lasts for 24 hours to 7 days, and the mode of transmission is through congenital, that is transmission occur at any time during pregnancy. Then neonatal acquired, that is infants with mothers who develop varicella lesions anytime from 5 days before the delivery to 2 days after delivery are at high risk for severe fetal diseases. Then the acquired causes are respiratory droplets. Okay, now the causes of vesicular rashes and the causes of maculopapular rashes. The causes of vesicular rashes are chickenpox, eczema, rash due to skin irritation or allergy, shingles, friction, bacterial infection, and herpes simplex. The causes of maculopapular rash are measles, allergies, and the atopic dermatitis. Now the vaccines that are the vaccines for chickenpox are varicella vaccine, and the dose is 0.5 ml and it is given subcutaneously, and the schedule is the 2 doses at 18 to 15 months and 4 to 6 hours, and second dose may be given 3 months after first dose, and the catch-up is complete 2-dose series. The complications of chickenpox are bacterial superinfection, which is the most common, and often Staphylococcus aureus, pneumonia, encephalitis, Rey syndrome associated with ingestion of the salicylates, and hepatitis, and infection during pregnancy. Teratogenic effects, congenital varicella syndrome, and zigzag scarring of the skin, shortened or malformed extremities, CNS damage, eye abnormalities such as cataracts or choriocentesis. Severe varicella infections in the neonate may develop if mother acquired varicella within 1 week of the delivery. Now, the management options for chickenpox are that for immunocompromised or severe diseases, consider acyclovir, that is skin infection, and varicella zoster immunoglobulins and supportive treatment. And for immunocompetent, supportive treatment is given, that is for secondary infection, and proper hydration is done. Non-aspirin antipyretics to avoid risk of the Rey syndrome, and calamine lotion to relieve the itching. The prevention of chickenpox is the isolation of the patient. No vaccine for healthy infants at age of 0 to 12 months. Give vaccine to susceptible immunocompetent contacts age greater than 12 months, and varicella zoster immunoglobulins to all immunocompromised and susceptible pregnant women. Also for susceptible pregnant women, newborn whose mother had onset of chickenpox within the 5 days before delivery to the 2 days after delivery. The differential diagnosis of chickenpox are Coxsackie virus infection, impetigo, papular urticaria, and scabies. So we have discussed the case of chickenpox, in which there is a patient who is having the history of fever and malaise for few days and having red spots on the neck and the chest, and blisters are present from the 2 to 3 days, and some blisters are macules, papules, vesicles, and pustules on her body. So the diagnosis is chickenpox. Okay, now we are having the definition that it is DNA virus, and it is contagious. Then the mode of transmission is congenital, neonatal, and acquired. Then the vaccine that is for chickenpox is varicella vaccine, and these are the complications. Then we have discussed the management options, the prevention, and the differential diagnosis of the chickenpox. Now coming towards next disease, that is mumps. Okay, so we are having a scenario that there is a 5 years old child developed high grade fever with earache. On examination, he was febrile and temperature is 39 degrees C and has swelling on both sides of his face, extended down and behind earlobe. Okay, the another scenario is that there is a 5-year-old boy come with pain and swelling and fever for the last few days. The parents has also noticed swelling around the angle of the jaw. Swelling has increased in size. Since then, he is complaining of headache and vomiting. So this is the mumps. Whenever there is swelling in the neck and fever, then the diagnosis is the mumps. Now we are having a definition that it is acute contagious viral disease characterized by painful enlargement of the salivary glands, especially parotid gland. The causes are adenovirus and the incubation period is 14 to 24 days. The investigation options for mumps are clinical, that is leukopenia with lymphocytosis may be present, serum amylase levels are elevated, virus culture done, enzyme immunoassay for mumps, that is IgG, IgM, and IgM antibodies present in acute illness. Now the differential diagnoses are cervical adenitis, suppurative parotitis, recurrent parotitis, and tumors. The complications of mumps are meningoencephalomyelitis, epididymo-orchitis, pancreatitis, deafness, and miscellaneous complications. The management options for mumps are that no antiviral treatment is available. Supportive treatment is given, that is analgesics, antipyretics, bed rest, semi-solid or liquid diet to avoid pain on chewing. The prevention is passive protection not indicated. Child should be vaccinated and MMR at the age of 12 to 15 months is done. Okay, so we have discussed the case of mumps, that we are having a scenario in which there is earache, high grade fever, and swelling in the neck. So we have the diagnostic of mumps. Then it is a contagious disease, viral disease, and it is characterized by painful enlargement of salivary glands, and the cause is RNA virus, and the incubation is 14 to 24 days. The investigations is clinical, and leukopenia is done, serum amylase check, virus culture is done, enzyme immunoassay for mumps is done, and IgM antibodies are present in acute illness. The differential diagnoses are cervical adenitis, suppurative parotitis, recurrent parotitis, and tumors, and these are the complications. The management options are supportive and prevention should be done. Okay, so here we have completed the unit of infectious diseases. Up till now we have discussed the following topics in the pediatrics, that is in the first video we have discussed the growth and development and the immunization and the psychiatric disorders, that is autism, pica, nocturnal enuresis, and the polio and severe dehydration. In the next topic we have discussed, next video we have discussed the TB, that is the infectious disease, the measles, enteric fever, the diphtheria, tetanus, malaria, pertussis, and in this video we have discussed the chickenpox and mumps. Now in the next section we will start the cardiology, that is CVS in the pediatrics, and we will discuss the tetralogy of Fallot, the TGA, the VSD, tetralogy of Fallot, PDA, ASD, CCF, and infective endocarditis, IE. All of these defects will be discussed in the next video. Thanks for watching.